currently my body mass index, my own, it is 23.5. So technically I am in overweight category.
I don't look like the...
No, nobody will say that I am overweight, but if you go by criteria, I am in overweight category. If they get a sugar of 103, they get worried. They come to us, doctor, my sugar is high. But if they are 1 kilo overweight, they won't even know that they are overweight.
Rice or chapati?
That is an interesting question. See, there is a saying, obesity doesn't run in family, but you're obese because nobody runs in family.
In association with Manipal Hospital's Dona Paula.
Hello and welcome on this episode of Hub Podcast. This Hub Podcast we bring to you in association with Manipal Hospitals. We are going to discuss an important topic today, and that is obesity. This is one topic which is affecting almost half of Goa's population right now, and to discuss this we have with us Dr Vikram Dalvi. He is consultant internal medicine from Manipal Hospitals. Welcome, doctor. Now, what is the difference between obese and fat, or it's the same thing?
Obese is more of a technical term. Fat is a common man's term.
So you become fat, people will say, and you become obese. Obese looks more, dangerous thing than you become fat.
See, essentially that both means same, but there is a classification of obesity. There is no classification of fattiness as such, which goes by your body mass index. So obesity is a disease which is classified into different grades.
Tell us about Goa scenario right now. You have been meeting so many patients, you have been treating them. Is obesity a major...
Well, it is extremely common. I am an adult physician and I see patients above age of 16. Right from age of 16 to age of 80. A lot of obese. I mean, at least more than 70% of my patients are obese or overweight, depending on the category. More than 70%.
More than 70%
of patients. In general population, the number may be lower, but as patients...
And precisely they don't come to you for obesity. They come to you for some other reasons.
Yes.
Okay.
They usually come with some other problem, and then when we tell them that, no, your weight is not correct, it is too much, then they are surprised.
So that weight also leads to those other problems?
Yes. See, why we see a lot of obese patients or obese people, let's not say patients, is because obesity, people don't know what is obesity, how to define it. Secondly, usually obesity is seen as a aesthetic problem, how we look. It is not considered as a disease. That is what we should do. And when we say obese, what comes into our mind is extremely obese people. Like that may be few of them, maybe 10% of people. But around 30 to 40% people, they are obese, but they are not morbidly obese. They don't consider them that they are obese because they don't know. So I'll give you an example. These days, a lot of patients do health checks regularly. Now the lab sugar, normal sugar level is 70 to 100. If they get a sugar of 103, they get worried. They come to us, doctor, my sugar is high. But if they are 1 kilo overweight, they won't even know that they are overweight. And what we see is patients who are 15 kilo overweight, 20 kilo overweight, 40 kilo overweight. And they are not aware that they have a problem. So that is the situation.
So just recently, I think people have started treating obesity as a disease. Earlier to that, they used to say कि खाते पीते घर का आदमी है, so naturally मोटा ही होगा.
Correct. So first thing we have to change is how we look towards obesity. It is not a cosmetic problem. It is actually a disease. What I call obesity, it's a mother of all non-infectious diseases. Because usually first you will get obesity, that will lead to diabetes, blood pressure, high uric acid, lot of cancers. Lot of people don't know that obesity increases chances of cancer. It causes liver cirrhosis. It increases chances of strokes.
So even if you don't drink, then your liver cirrhosis could be because of obesity.
Yes, very much. Okay. And in younger people, what we see is infertility. In ladies, it is, you must have heard the term PCOS, polycystic ovarian syndrome, causing problem with periods. And gents, they get erectile dysfunction, which is again related to obesity. So even in younger generation, there are problems. Osteoarthritis is another that we didn't discuss. But knee problems are so common, and it is significantly related to extra body weight.
So how do you know that you are obese?
So if you go technically, there is a classification by body mass index. Body mass index is nothing but a relationship between your height and weight, and there is a formula. So till now, in general for the world, anything above 25 was considered as overweight and above 30 was considered as obesity. But obesity, as we know now, that it leads to diseases, and that's why the classification for Asians, that is us, it had changed. So anything more than 23 is called overweight now. 23 body mass index, above 25 is obesity. So currently my body mass index, my own, it is 23.5. So technically I am in overweight category.
I don't look like
No, nobody will say that I am overweight, but if you go by criteria, I am in overweight category.
But can you actually be in shape all your life? There are times when you cross your 40s, you touch your 50s, then
Yes.
you tend to say ki okay, ho gaya, now mujhe khana hai, pina hai, I need to enjoy my life.
Yes, you should enjoy, but what has happened is in past or earlier generations, they used to enjoy on festivals. Now our definition of enjoyment has changed. We want to enjoy every day. So if you want to enjoy every day, later in life you will have to pay. Pay with your health. So what I told was a technical definition of obesity. Something very simple I'll tell you, what you can do at home, you don't need a calculator, is you check your height, you check your weight. If you are a gent, height in centimeters minus 100 should be your weight, maximum weight. For example, I am 171, my weight should be maximum 71.
Okay.
Now if I am a lady, then it is height minus 105. So I am 171, my weight should be 66 if I am a lady.
Okay.
And third, even easier definition of obesity is you check your height, you measure your abdominal girth around level of navel. That girth should be less than half of your height. So suppose I am 170, that girth should be less than 85 centimeters. So you can go home, check what is the situation. If it is more than half, then you are in obese category.
And you need to take medicines to decrease the obesity?
Right. See, there are two things we need to consider. One is to treat obesity and second is to prevent. Prevention is always better than cure. Now there are multiple options available to treat obesity. The first thing is lifestyle change. Absolute first thing. So even if you are going for the other options which are available medically, lifestyle changes still remain. So lifestyle changes or lifestyle changes plus something else. It is not only that. Okay.
Lifestyle change is must.
Must. And we always say lifestyle changes, what does it mean? One is diet, second is good sleep, and third is exercise. We always say that weight loss happens on dining table. It doesn't happen in gym. That's the most important part. So diet is extremely, extremely important.
Okay, so one is diet. That is prevention.
No, treatment and prevention, both, it applies to both. So one is diet, second is getting very good sleep, at least 7 hours at night of sound sleep without any disturbance. If the sleep is not good, if it is at wrong hours, then our cortisol level, it's a hormone, it goes up and it doesn't allow body to lose weight. And third is exercise. So walking is absolutely basic if you cannot do anything else. If you can do anything else which is more intense, for example playing football, cycling, swimming, lifting weights, these are much better exercises. But what we have to remember is exercise helps in maintaining muscle mass. You can lose weight just by dieting without doing exercise, but when you do that you lose muscles as well as fat. But if you are exercising and dieting, then you lose mainly the fat. Muscle loss is much less. So
in case of Goa, what are the factors? One is lifestyle, and I think it's across it is India kind of concept.
Yes, absolutely pan-India. And you will see obesity more where people are financially better off.
Okay.
So what happens is this starts in childhood, right from when the child is in 3rd or 5th standard. That is when the malnutrition starts. See, typically when we say malnutrition, what comes to our mind? Very thin children. This is what we have is exactly opposite malnutrition. Excess nutrition. That is also a malnutrition.
Acha, mal is bad.
Mal is bad.
Okay.
Either way. Too less or too much.
Okay.
What happens in Goa is too much of nutrition. Now, when we say too much of nutrition, a lot of patients or a lot of people will say that we eat healthy. So, you may be eating healthy food, but probably you're eating more than what you need. So, one is quality of food, the other is quantity. So, maybe a lot of people are eating good quality food, but not good quantity. They are eating more. And this starts right from school age, where they are moving less and they are eating more than what they need. And the trend continues. Once you start your graduation or post-graduation, then you don't have time to move, but you keep on eating something similar. You get independence, you start moving outside, night out with friends and all, and the lifestyle worsens.
So this is a common in case of everyone, not only in Goa.
It is common in everyone, but see, Goa, as I said, financially we are better off. In general, Goa is better, and that is a problem. Unless you are paying attention to what you are eating.
So pet nahi to set nahi is right. It's like pet is equal to set right now.
Correct.
But it's dangerous.
It is absolutely dangerous. It is going to lead to a lot of other things.
But we have seen some people who are morbid obese, and it comes from the hereditary also. We have seen their father is fat, that's why they are fat. There's a family of fat people. So he has inherited it from his parents. So how do you blame his lifestyle for that?
Right. See, there is a saying, obesity doesn't run in family, but you're obese because nobody runs in family. So, that's a saying. But yes, obesity, one of the risk factors is family history. So some people have a tendency to quickly gain weight. I have that tendency. If I don't pay attention to my diet, I quickly gain 5-6 kilos in 6 months. So those who have the tendency and family history of obesity, they have to be even more cautious of maintaining their lifestyle. And even then, obesity can be treated.
But it's not hereditary. It's not in your genes.
No. Yes, it is in genes.
Okay.
But that is not the only factor. See, every disease has two types of risk factors. One are modifiable, that we can do something. The other is non-modifiable, that we cannot do anything. So hereditary, your age, that comes into non-modifiable. We cannot do anything. But what we have to do is what we can change, which is lifestyle, what you eat and how you eat.
So what we should eat?
Okay. Now, before we answer that, first we have to consider how we spend our energy in a day. Okay. So, in 24 hours, whatever we spend, it is called as total energy expenditure in 24 hours. Out of that, 70% is something called as basal metabolic rate. Okay. That is energy that you will spend even if you are sleeping throughout the day, because your heart is beating, your brain is still working when you are sleeping, your breathing, the breathing muscles are working, so you need that energy. Then about 10 to 15% is what you do in day-to-day activities. You go to market, you go to your office, we see patients on the round. That is non-exercise activity. Third, 10% is the calories that we need to digest food that we eat. And fourth, only 10% is exercise.
Okay.
So out of 100% energy that we spend, only 10% is exercise, 70% is basal metabolic rate. So to lose weight, what you have to do is eat less than what you are burning. That's the basic simple formula. That's the first formula. And whatever you are eating, you have to maintain correct ratio of protein, fat and carbohydrates. So when you are eating in something called as caloric deficit, you are eating less than what you are burning. Then you gradually lose weight. So that is non-medical treatment part of it.
Then there is a medical. We'll come to medical later.
Yes,
But as
yes.
this is also my personal question. We have been eating X quantity for all these years. Suddenly, I'm advised ki eat less. Then you have cramps. Then you have, you get irritation. Then you are not able to concentrate. Then you go and you eat.
See, any change, we have something called as inertia. Body resists that change. So you have to be consistent with your efforts. Gradually the body gets used to it. Then it will accept. Secondly, when a doctor or someone tells a person to eat less, initially they are over enthusiastic. So rather than cutting 500 calories only in a day, they suddenly cut 1000 calories. Then it is too much. And in an attempt to lose weight quicker, they start exercising suddenly. So it's like a double whammy. Suddenly the body is under stress of exercising more and eating much less than what it needs. And that is what leads to problems initially. But gradually the body will get used to it.
The best way is to consult dietitian.
You can do it on your own also if you have time to study food. It's pretty simple. Pretty simple. You just have to give 15-20 minutes every day for 5 days. You will know what you're eating. But suppose that is not possible, then dietitian is a good option.
Okay, second is about when you're obese and there are obese comes to you, and let's talk about medical part of it. There are also options wherein they speak about, I don't know what do you call it, removing your mass and you look thin.
Yes.
That kind of thing. Is it advisable? Maybe something like plastic surgery or something.
So here what comes, where the classification comes into picture. Obesity has 3 grades, 1, 2, 3. 3 is something called as morbid obesity. It's very high obesity with other diseases coming in, like diabetes, pressure, already they are there. So that is when medical treatment of obesity is needed in addition to your diet and exercise. That always it is there, exercise and diet. Okay. Now what you were talking about is typically called liposuction.
Okay, yeah,
which
correct.
removes fat under the skin. That is a cosmetic surgery or plastic surgery. It doesn't treat obesity. Our problem is fat which is inside the abdomen, around the liver, in the liver, around the pancreas, around intestines. That is the bad fat. To treat that, there is a surgery which is called as bariatric or metabolic surgery, where they don't do directly anything to the fat. They cut a part of stomach, and that leads to a lot of hormonal changes, which indirectly leads to weight loss, a good weight loss, 30 to 40 kilos of weight loss. So that is called as bariatric surgery, and that does help.
There is something called intermittent fasting. Again, these questions I think we asked for last podcast. Those who have missed, please watch it again. Intermittent fasting, is it advisable?
Okay. So when we are thinking about dieting, the first thing you have to stick to is your caloric goal. How many calories you are eating? Suppose it is 1500 calories. Now if you are eating 1500 calories by eating only twice, say 1500, or each time you're eating 300 and you eat 5 times, doesn't matter. As long as you're sticking to that goal of 1500 calories, you can eat once, you can eat twice, you can eat 10 times. That's all right. Intermittent fasting, where it helps is some patients or some people naturally eat less in that method. But there are some, because they think that they are doing intermittent fasting, so there is no limit to it, and they actually overeat in those 2 times, and they actually gain weight. So intermittent fasting, it helps provided you are under eating. Otherwise it doesn't.
Some people say ki you should skip breakfast. Some people say you should breakfast is a king and you should have a good breakfast.
Okay, let me ask you a question. What is breakfast?
Breakfast is when we get up in the morning, and that's when we break our fast, last night's fast.
Correct. So get up in the morning is not the correct part, but breaking the fast is correct part. Okay, breakfast is breaking your fast. Correct. So breakfast should be heavy, but nowhere it is told that it has to be done in morning. Achha. You can break your fast at 1 o'clock in the afternoon, call it as breakfast.
Okay.
And that time you eat well.
Brunch.
Because you have been fasting for say last 10 to 12 hours. That is why you need a good breakfast, good amount of calories.
So it doesn't matter when you get up. It is when you break the fast.
Yes, that is breakfast. And everybody has a pattern. Like you may be comfortable skipping only the lunch. Somebody else may be comfortable skipping only the dinner. I can easily skip breakfast, but I cannot skip lunch or dinner. So you have to find your own pattern, and then you follow that. So whatever is applicable to 90% of population may not be applicable to you. You have to find your own pattern and find out when you can eat less. That's the best timing of dieting.
One question everyone asks, rice or chapati?
That is an interesting question. Okay. So all the cereals are what we call grains. It comes rice, wheat, jawar, bajra, ragi. All of them have 70 to 75% carbohydrates. Okay, about 8 to 10% protein, remaining is fat. All of them. So if you are eating equal amount of each grain, and we are measuring in dry, then the amount of calories you get will be same. But there is something interesting. Have you anytime weighed rice before cooking and after cooking? So if you take 100 gram of rice, you cook. After cooking, it becomes 300 grams. Why? Because a lot of water goes in.
Okay.
Whereas you have made atta, you made dough, and you roast it. All the water evaporates.
Okay.
So if you are eating 50 gram of chapati, for example, all of it is actual substance. But if you are eating 50 grams of rice, only about 20 grams is actual substance, 30 gram is water. So if you eat 50 gram of chapati versus 50 gram of rice, eating 50 gram rice will help you in weight loss, which people don't realize. And they suddenly shift from rice to chapati and they may not see weight loss.
And which is the youngest age patient you have treated?
Well, for obesity. Obesity in early 20s, below 25.
Below 25.
Yeah.
Then, because they are fat. If a child is fat, then what do you do?
See, first, in any patient, not only child, any patient, somebody is obese, we have to find out why he is obese. There may be some medical conditions, for example, hypothyroidism, or something called as Cushing syndrome, or some drugs may be causing excess body weight. Once those are ruled out, we go into their lifestyle. What is happening, why they are eating more or why they are moving less. And then we try to pinpoint the problem and treat that. So it takes a lot of time for history taking, where they are going wrong in day-to-day life. So we try to correct that. But suppose they are in grade 3 obesity, which is highest grade of obesity, then only lifestyle is not going to work. Then we have to refer them to bariatric surgery, or you must have heard new options like Mounjaro or Ozempic, injections. Yeah. There is something called gastric balloon also. Then we have to consider those options.
This Ozempic has become a buzzword right now.
Yes, absolutely.
And we have heard that you shouldn't take it without consulting doctors.
Correct. Absolutely.
And if you are diabetic, you should never take it. It worsens.
That is something odd. I am
okay, no. So mine is a very insta-real kind of knowledge.
Correct. So, see, Ozempic was originally developed as a diabetic medicine. Now, while they were testing, they found that it is causing weight loss.
Okay.
And it was helping not only diabetes, it was protecting liver, reversing certain liver issues, improving kidney outcome, improving heart outcomes. So then it was a side effect, weight loss, which has come to fore. Now it has become weight loss medicine. But it is clearly indicated in those who have grade 3 obesity, which is morbid obesity, or they have obesity plus diabetes. They are excellent medicine for diabetes with obesity, excellent medicines. But they have their own problems. First is a cost. Cost is around 8,000 per month.
Okay.
And mind you, it's a lifelong medicine. Because if you stop, then the weight is going to come back. Okay. And that is what happens. Like you start taking, you lose 10 kilos, you stop, almost 10 kilos are going to come back in next 6 months. So lifelong medicine. So you calculate. 12 months into 8,000, around 1 lakh.
Yeah.
Year. Take it for 20 years. 20 lakhs you are losing in that.
Just to lose.
One. Second, it causes severe nausea. A lot of patients these days have something called as reflux disease. It worsens.
Okay.
That gradually settles. Rare complication is pancreatitis. Rare but quite serious. And we don't use it in patients who have history of thyroid tumors, because in those patients it may cause thyroid tumors. If there is no family history, then we are not worried. There is some unusual side effect that is coming up is a type of blindness. It plays with one of the nerves in the eye.
Okay.
Again, very rare, but we have to watch for that. Somebody who already has retinal problems, then we avoid using it.
So do you advise to take it or you don't advise to take it?
In appropriate patient, they are like wonder drugs. But you have to choose patients correctly. You cannot, 10 kilo overweight, okay, start. That we cannot do. We have to first have clear defined criteria, whether the patient is fitting into that, then look for contraindications. Does he have anything of those? Once everything is correct, then only we start. And of course, then we have to monitor as well. So these are excellent drugs, but they have to be used in correct patients. It's not for every overweight person.
Is it also anti-aging, the way you said that your heart reverses, your liver gets...
It's not anti-aging.
Like your age doesn't go back to 25 years down.
It's not anti-aging. It has certain hormonal effects. But the same effects, if you treat obesity early, by lifestyle changes, you will get the same effects.
Okay.
So that's why grade 1, grade 2 obesity we don't use. You still have that option of only lifestyle and changing that.
So it's not a hack to, save yourself from getting older.
No. And if you're taking medicine, you still have to do exercise and diet.
Okay.
There is no running away from that part.
So it's not like just take the medicine, sleep and you are getting thinner.
No. And the other problem is a lot of patients, they take medicine, but they are not lifting weights and they lose muscles. And that's a bad thing to happen, because most of the patients are going to stop it after a few years. When the weight comes back, it is almost all fat. The muscles don't come back.
Okay.
So when you're taking the medicine, it is very important to take, to do resistance training, which is we go into gym, lift dumbbells, lift bars. That is very important.
Okay. So it's not a shortcut.
Not at all. It's a lifelong commitment.
Okay. Okay. Last, what do you suggest right now for those who are watching this podcast and who are feeling that we are getting obese or we are obese right now? Immediate few things that they should do.
Correct. So first we have to start from prevention. That has to start at school level. So if school principals are watching this, then I will definitely recommend to arrange sessions. In fact, we have a program running for weight loss. It's free of cost at Manipal Hospital. Once a month we conduct a batch and we tell them how to lose weight.
Okay, so let's repeat this. This is important. And in Manipal Hospital,
once a month we have a session of about 2 hours and I explain them how to actually do dieting in a scientific way. It's a free of cost.
And how do someone get an appointment for that?
So once the date is decided, then we spread the word through social media and they have to register.
So follow Manipal Hospital's Instagram account.
Yes, and they only 30 people we take at a time. Because if there are more, then I cannot talk one-to-one to anyone. Way. So we have to start from school. So school should be arranging a lot of meetings. Second, adults, first you have to find out whether you're obese or no. So your height, your abdominal girth. Abdominal girth more than half of your height, then you're obese, you need to do something about it. The first thing you have to do is start eating less. Whatever food you're eating, even if you reduce by 20%, eat same food, but reduce the quantity.
Okay.
And start doing 30 minutes of extra work, physical work, any kind of work. Maybe you go to market. Start doing that. And third is monitoring. See, there is something in management which is called as PDCA cycle, which is plan, do, check and act.
Okay.
So you have planned eating less, you have planned doing something, you have started doing it, but you have to keep on checking whether it is working or no. If it is not working, then you need expert advice. For first 2 months, you do it on your own. You don't need any expert as such. But if it is not working, then you need some expert.
Those experts are doctors?
Doctors, nutritionists, both.
Okay. Thank you very much, doctor, for joining us. So, this is retake Gatare. So this was Dr. Dalvi from Manipal Hospitals, and please watch this podcast right from the beginning if you want to know how to lose weight or how to prevent being obese. We are bringing this podcast to you in association with Manipal Hospitals. Keep watching us.